Innovation Model session this afternoon. This session will end at 2 o'clock, and then we will have an East End cupcake break right before the last sessions where we introduce the CEO champions and the 20 and 20 winners. I want to point out a couple of things. There is an evaluation form out in the desk where you're registered. If you would mind taking a few minutes and filling that out, that will help us hopefully make next year's event even better. And then also I wanted to let you know if anybody was enthralled with the speaker this morning as much as I was, and want to know a little bit more about what kind of amazing scientific discoveries are happening in our state. The Jackson Lab is having a session here on October 30th in this very auditorium from 6 to 8 p.m. And if you mention that you attended today's session, they will give you a $10 discount on that admission. So I don't want to take any more of your time, so you can use it wisely. I'm going to introduce to you Randy Chenard, and Randy is going to introduce the rest of the panelists, and they are going to tell you about the state innovation model. Thank you.
Thank you, Nancy. Good afternoon, everybody. My name is Randy Chenard. I am the program director for the state innovation model. After spending 22 years in the private sector, was provided this opportunity to work on exciting healthcare transformation in our state. I'm happy to be here today to provide you a high-level overview of the state innovation model, how we're structured, and what we hope to accomplish, etc. With me is a distinguished panel, far more distinguished than myself. I will hand it over and allow them to introduce themselves and their roles in the Symp brand.
My name is Ellen Schneider. I'm with the Maine Health Management Coalition, and I'm the Coalition's Symp Project Director.
Hello, I'm Katie Sensei. I'm the Program Director for Health InfoNet.
I'm Celine Turtle, Executive Director with Maine Quality Counts.
Hello, Michelle Probright, Director of Strategic Initiatives at Maine Care.
What we're hoping to, what our objectives are for today, and that's to provide an overview of what the Maine State Innovation Model is. We'll talk a bit briefly about innovation and transformation, because those are two key concepts and themes of Symp, as it's more commonly known. We'll talk about Maine's Symp structure and how Maine is approaching the innovation under the model and focusing on areas within payment reform, delivery system reform, and data infrastructure. We'll talk about collaboration and what the message of collaboration is within Symp in our state and the importance of that. Talk about at a high level, some Symp components. And then specifically, which is appropriate obviously for this symposium today, what does this mean to the commercial sector? And that will be we're hoping to present some information for about the first 30 minutes and then hope to have some interaction and get your thoughts on what potentially are some barriers to innovation in the commercial sector today and how Symp can potentially address those. So this slide we know this, right? You've probably seen it several times already today in various forums and breakout groups around the fact that healthcare costs and the trajectory is unsustainable for our country as a society. So this is just another way of saying we can't keep going in this direction, and what can we do about it? And what Symp is, the State Innovation Model. I'm going to turn it over to Ellen in a moment to talk about where Symp came from and what some of the high-level objectives are in the federal government. But really is funding that enables our state to try things, to innovate things, to change this trajectory. And how we do that and how we go about that is what we'll spend some time talking about today.
Okay, just briefly, let you know sort of high level where Symp came from, what the heck it is. Again, it stands for State Innovation Model, and it's a federal grant initiative It's actually a $300 million initiative that's run through the Center for Medicare and Medicaid Innovation that lives inside CMS. And it's a program that was authorized as part of the Affordable Care Act. And just as a side note, the money for the initiative, which is something, as a former CFO, I care about, knowing that the funding stream is going to continue since we're all investing a lot into the initiative, is a separate pot of money. So even if the ACA were to go away, the pot of money to help our state move innovation forward will still be available to us. Back last fall, the feds put out an RFP calling for proposals from states that were interested in proposing projects that complement the federal government's intention, which is noted up there in the second bullet, which was to go after or further efforts to design or test innovations intended to transform state-level delivery systems. Not surprisingly, they also list as one of their primary interests generation of savings and improved care for populations that the federal government is responsible for, which are the Medicare, Medicaid, and CHIP beneficiaries. Maine put together a proposal, submitted it last fall, and in April, the feds announced awards. And in addition to maybe 12 or 15 planning and design grants, they decided that 6 states qualified for testing grants. And those states include Arkansas, Maine, Minnesota, Massachusetts, Oregon, and our neighbor Vermont. We are getting $33 million in this state. Comes in, I think the governor actually may be the awardee, the governor's office or the commissioner. And it's over a period stretching from April of this 2013 through September of 2016. We are now in the implementation phase. It started last Tuesday. So we're all scurrying around implementing now. Back to you.
So, what is it? What is the Maine State Innovation Model, and how do you describe it concisely? We've been working on that collectively as a team over the last several months because it's very complex. There are a lot of separate initiatives and focus areas that are contained under the Symp umbrella, so trying to describe that in a concise way is what we're working on, and what you see in front of you here is our latest iteration of our elevator speech, so to speak. So three main bullets that we use to try to describe what Symp is for Maine. The Maine State Innovation Model funds and sponsors the development of tools, support structures, and reports that are expected to positively impact the goals of improved quality, improved patient experience, and reduced cost in healthcare. So there are sort of buckets of development that are going on that Symp is funding. In some cases, new development, new innovations, and in many cases, accelerated innovations that are included under this state innovation model. The existing and emerging healthcare models in Maine will be testing these innovative capabilities at different levels. And that's also an important component of the overall test. We obviously, in Maine, and one of the reasons Maine is one of the 6 states that was selected to receive this grant, as Ellen described, was that Maine is already far down the road in terms of innovation in our models with our accountable care organizations, Pioneer, Beacon, etc. These models will all be part of the test, but it is not prescriptive in terms of how these models use these capabilities that are being developed under Symp. So they'll all be participating at varying levels. And Symp will be looking at the impacts on those models as they use these capabilities and integrate them in their operations. The state, as I started to mention, the state's role, among several things, but potentially the most important, is to publicly report on the impacts of these innovative approaches to all of the healthcare delivery models and to the state at large. So at the end of 3 years, our objective and our hope is that we have a clearer understanding of how these innovations are impacting quality of healthcare, quality of patient experience, and the reduction in costs. And that's really what innovation is, right? You try a number of things, you see what works, and you build on that. So Symp provides a mechanism, funding, a structure to do that more collaboratively in a more integrated way. As I mentioned before, Maine has had many healthcare innovations going on over many years. Symp coordinates that activity and hopefully provides synergies and alignment with those innovations that have been going on at times in silos, not connected to one another. So that's our latest version of our elevator speech. Hopefully that helps. Welcome your feedback, because we're working on improving that as we move forward for sure. We also have a hypothesis, and it's as follows: is that the introduction or acceleration of innovative capabilities into our current and emerging healthcare models will enable Maine to realize improved quality of care and improved patient experience while positively impacting health outcomes, population health, and cost. So as you can see, Symp is an and. It's not going after cost or going after quality or going after patient experience. It's looking at all three, and we still have some work to do to determine what is the dashboard going to be that we're going to be watching closely to determine how these innovations are impacting all of those goals under the triple aim. The following areas are the focus of Maine's healthcare innovation: transforming delivery systems to support accountable and integrated patient-centered primary care, aligning public and private payment accountability, quality, and data infrastructure, and fostering engaged consumers and communities. So all of the separate projects, if you will, innovations that are under Symp are aimed at one of those three areas. And we're organizing the work in that manner as well. And we'll talk a little bit more about that in a little more detail in a bit. The last point, which is important to describe, is the approach that Maine is taking. And at the bottom of this slide, it says that Maine will be utilizing an approach that leverages partnerships between the public and private sectors. And that from a federal level, from CMS looking at all the innovations and all the states that are involved with Symp, they're looking at Maine's approach, and Maine's approach is a bit unique than some of the other states are doing. We are really, Maine believes, and our approach for Symp reflects that real transformation comes from a broad-based group of engaged stakeholders that drive that reform and transformation versus a top-down prescriptive approach coming from state government. So the state's role in Symp is to convene that collaboration and believes that will develop a longer-lasting approach to transform healthcare in the direction that it needs to go in. So that is something that CMS has told us, that Maine is a little bit unique in terms of our approach. We believe that the approach will create more sustainable change, and they're watching us closely as part of the broader nationwide test as well in terms of how that works out. Next step is next slide is a little bit of a transition slide, and we've used these words. We use them over and over again in Symp, we use them over and over again in business, but innovation and transformation. And I think it's important to understand that how important those themes are to the state innovation model, and that this is about trying things and really understanding clearly whether those things that we're trying are working. We expect them to be. They're based on experience, but we really need to know whether that innovation that is being new or enhanced is creating value, is going towards those triple aims. So we've done a lot of work together to try to align what our ultimate high-level objectives are to all of the things that are part of SIM to ensure that we can understand the cause and effect. So innovation being a key theme. And for those who've been involved in innovation in your organizations, you know that an important way to approach innovation is through many small tests, right? And understanding what those small tests, what the impacts are, as opposed to one big thing, let's do this. It's many small things, and learning from those small tests over time. And that's, again, what SIM is. And transformation is just talking about the process of profound and radical change that orients an organization in a new direction and takes it to an entirely different level of effectiveness. And of course, that's the ultimate objective of SIM, along the lines that we were talking about, to hopefully inform us as we're on our healthcare transformation journey as to what direction we ought to be taking and learning more as we go in a scientific way.
Can you define organization in that statement?
To be honest, I took that definition from the web. So that is not specifically meant to describe SIM and the organization. So that's broadly, and in whatever you're looking to transform, so the definition of organization there would be, in the context of SIM, would be healthcare.
So this is a concept statement.
Yes. Starts to get, with this slide, just a pictorial representation of some of the key themes of SIM, and what we have here are sort of the mechanisms where healthcare is delivered in the state, and that's multi-payer ACOs, and then integrated patient-centered care, SIM looking to really provide innovation and support to those structures, and through the structures around those, what SIM is doing, and investing in leadership development, consumer engagement, community linkages, and workforce education. So part of SIM funding is going towards those types of initiatives, which we infused into the emerging and existing models that exist in the state. And then along the bottom, a more sort of fundamental, foundational concept is the importance of health information and the tools and data and analytics and access to that information that is a key foundational component of the ability to improve healthcare and reduce costs. And there's lots of funding within SIM that Katie Sensei will speak to in regards to what's going on with data infrastructure and how that is being enhanced under SIM. Okay. Last slide from me, and then I'll start turning it over to my partners here. But this is generally how we've structured our approach for the state innovation model in Maine. And as you can see, we've got the image of the state in the middle, and the state really is acting as, you know, a lead convener of this innovation, right? And taking on and ensuring that public reporting is done well and collaboratively developed in terms of what is reported, and that we're all agreeing on what we should be pointing to in terms of what's working and what isn't. A SIM dashboard, so to speak, development of that and reporting on that. State will be taking on the role of sharing the best practices among the organizations that are involved, and then really driving and expecting collaboration among the structure within SIM. And as I mentioned, Maine's approach is unique. We have really developed a robust governance structure that includes a steering committee, for example, that has broad stakeholder representation throughout healthcare, from payers to providers to consumer representation, consumer advocates, et cetera. That is the steering committee that is really making the decisions on how we're moving healthcare forward and what we're doing under SIM and what we're looking at. So the state's sort of playing that convening role. and will be doing the reporting. Off to the right of this image of the state is the Maine Sim triple aim goals. We're starting, as I mentioned before, at the highest level, and we're going to do a lot of things to break those goals down, and that's work we have to do. But starting with the fact that we want SIM, our objective is to reduce the costs of Maine to the national average. We're currently above the national average. We want to reduce that to the national average. We want to improve health in key health categories, and we're still working through what those categories are that we'll be looking at. And we've got to be careful not to try to boil the ocean here with the SIM grant. So, you know, that we need to pick the areas that we think that can be influenced through this innovation and see if that works. So really, creating more focus is going to be important. Improving patient experience scores and increasing practice experience participation are two other key high-level targets that we'll be looking at. And as I mentioned, we'll be breaking those down as we move forward. The oval to the left of the state image just speaks to the payer populations that are part of the test, so to speak. And I mentioned before what that means to be part of the test is just that we're reporting on the metrics that will be defined under SIM, right? Maine Care, Medicare, the commercial payers, the Maine community health options will be included as the payer population, and self-insured employers. All of those groups will be looking at and including in the analysis and in the measurement under SIM. The structure that we've developed is to create partners under the SIM grant that the state is working closely with to organize all the efforts. And the three areas that we're focusing on, these are also subcommittees that report up to that steering committee group that I described, are payment reform. So there's a lot of efforts under the payment reform heading that we'll be moving towards. That's chaired by the Maine Health Management Coalition. Ellen will speak in more detail about that. Data infrastructure, Health InfoNet is chairing that suite of work. Katie Sensei will be speaking to that in a moment. And then system delivery reform is another subcommittee that will be overseeing work to reform our system delivery, chaired by Maine Quality Accounts. So hopefully this gives you a good sense of how Maine is approaching this in a collaborative nature, and expecting and needing that collaboration between these three key partners and the state as we move forward. So with that, I'll hand it over to Ellen to speak a little more in detail about payment reform.
Thank you. As Randy mentioned, the coalition's heading up sort of this broad category of work and labeled payment reform. It's actually a bit broader than that, but we'll stick with payment reform for shorthand. But we've got this wide range of initiatives that fall under SIM and under our umbrella. And there are lots of opportunities for folks to get involved. And as Randy mentioned, collaboration is key here. It's not just collaboration amongst the major partners in the initiative, but it's collaboration at a community level as well. So on my slide, you can see in parentheses there are sort of like little acronyms, ACI or PTE or VBID. These are initiatives, sort of ground level, roll up your sleeves, sit around the table with your colleagues, and opportunities to participate in the day-to-day work to push this transformation forward. So SIM's constructed to give as many people as possible a voice and an opportunity to participate, and I encourage you all to do so. So under the rubric of payment reform, we are facilitating a learning collaborative that's focusing on innovative payment approaches that are either in use or under development here in Maine or elsewhere around the country. If you heard Dr. Fendrick this morning, it was certainly provocative discussion that he led this morning, but value-based insurance design and value-based payment is one of the things this group will, the coalition will be focusing on. We'll have a specific work group working on VBID and talking about VBID in greater detail, and they will be feeding ideas into this accountable care implementation work group that any of you are invited to join. We talk focusing on bundled payments, for example, health homes, again, value-based purchasing, Maine Care's new accountable communities initiative, which I promised Michelle I put in a plug for because it should be up. The RFA should be posted today, so all of you in the provider community there want to take a look for that and give it careful consideration as soon as you leave this room. We will be tracking cost of care in Maine, including the cost of behavioral health care, and we've got 2 work groups that are focused on that. So it's a good chance to get in, learn more about how to measure cost of care and track it, give us ideas, give us feedback. If you're familiar with the coalition, you're probably familiar with our Pathways to Excellence program, which is the process that we use to develop metrics to publicly report out on quality. Symp lends resources, brings more resources to the table to make that process more robust, and we are standing up a new work group around behavioral health. It is brand new, it's a new venture for us, putting our toes in waters we're not yet familiar with, and we are looking for folks to come sit around the table, ready to collaborate, help us develop those metrics, build on work that's been done by Lisa and her colleagues and other folks on the state in terms of metrics, looking at integration of behavioral health and primary care, but also in terms of quality of behavioral health care. And finally, there are a number of initiatives included under Symp that are run out of the Department of Health and Human Services around implementation of the National Diabetes Prevention Program and the development of a community health worker pilot. And we will be exploring ways to develop payment supports for those initiatives. So with that, I'll pass it on to Kate. Oh, you're not next? Well, whoever's next. Lisa's next.
Sorry.
Great, thank you. I think we're sort of speaking here from 2 perspectives. One is, what are we doing as a contracted partner with the state under the Symp initiative, and then what is the role of the subcommittee that we've been asked to support. So we're both kind of speaking, we're all speaking from both of those perspectives. So to start, in terms of our role at Maine Quality Counts, in terms of a contracted partner, ours is much simpler than those guys. Ours is really about providing quality improvement support to the medical home initiative, and importantly, the additional 82 practices that are in the Maine Care Health Homes initiative. Under the multi-payer pilot, we've managed to cobble together support through the Quality Forum and private foundation funding over the last several years to be able to offer outreach education support to the 75 practices in the multi-payer pilot. And that's consisted of things like having staff directly in touch with them, a learning collaborative where they come together, periodic learning sessions, team webinars. That we didn't have those resources to offer to the additional 82 practices that have been in the Maine Care Health Homes initiative, which is a parallel effort, similar expectation, really the same kinds of expectations. Payment from Maine Care only, so the practices don't have quite as much resource around their efforts to redesign practice. And up until now, really have not had that quality improvement support. So that's what Symp funds. It funds us as quality counts to do that. And we've tried to scale up a bit. We're still looking for some external quality improvement coaches. If people know folks who would be good out in the field to work directly with some of those practices from up north to down east to the west to the south. So because that's an important part of that support as well. So that's our role, and we really just started that in the ramp-up phase from July to September in terms of just figuring out exactly who they are, who are the lead contacts in each practice, who do we email, who's in charge of contacting the rest of the team. We've been holding webinars with them once a month. We'll get them together for the first time at a learning session in February, and then really try to meld them together with the 75 practices in the multi-payer pilot in what we call our expanding movement, our state movement around medical home and primary care transformation. It has important links to the other initiatives, including data. How do we use Health InfoNet to provide those practices with alerts so they know when their patients are hospitalized and discharged and can see when they've been seeing other providers. It has important links to payment reform. What does primary care payment look like in this brave new world? The multi-payer pilot is scheduled to end at the end of next year, 2014. What happens after that? How does primary care payment get structured in this brave new world of ACOs? Are there other models that could be used for primary care payment to really support this work? So clearly has links, but that's our specific role. More broadly than that, we've also been asked to chair and support this delivery system reform subcommittee, which is the umbrella under which we'll really group all of the initiatives under Symp that have to do with delivery system reform, meaning how do we change the healthcare delivery system. The subgroup will be asked to provide guidance and input on a range of activities, some of which we're doing, others of which are expected to be RFP'd out or somehow connected to this work that's happening. And those are things like input on the learning collaborative that I just mentioned around primary care, so medical home, health homes. There's also the intention to support a learning collaborative for Stage B of the Maine Care Health Homes Initiative. Stage A is what we're in right now. It's for people with chronic illness. Stage B is specifically for patients with serious mental illness, adults with serious mental illness, or children with serious emotional disturbance. That's a whole parallel initiative that Michelle and Kitty Purrington from the state have been helping to develop. The hope is that will be launched by the beginning of next year and will be offered to organizations that step forward and sort of raise their hand or qualified as behavioral health home organizations that would work in partnership with primary care to address the behavioral and clinical medical needs of these patients, because we know that these patients with serious mental illness die on average, I think it's 15, 20 years younger than their non-serious mental illness peers. That's really built on a lot of the work that's been done in the state through the Multiple Chronic Conditions Initiative, Dr. Elsie Freeman, folks at Muskie. So looking to run a similar learning collaborative like we've done with primary care for these behavioral health home organizations and their primary care partners in some way, shape, or form. So that's all to be determined, but this subcommittee would provide guidance on that. Additionally, there are initiatives such as related to workforce development. So Ellen mentioned a few that the Maine CDC is being asked to take the lead on, and that is development of community health worker pilots. So recognizing that the community health worker model is one that's really been developed and tested in many other areas of the country. Actually, it's one of those areas I always say, we're not in the lead on that one, so we need to be in the lead. So Maine CDC will be leading the development of 5 community health worker pilots, and again, we need to pay attention to what's the payment in a sustainable way, but what's the clinical model, and are there certain communities or conditions or ways that could be tested. So folks from the CDC will be leading that, and the whole process about selecting those will be developed. Again, this subcommittee will provide guidance and direction on that. Ellen also mentioned the diabetes prevention program. So another evidence-based program that's been out there for a while. How do we really prevent diabetes, recognize pre-diabetes, and offer lifestyle changes to patients through better exercise, healthy diet, some weight loss to help prevent diabetes. So getting out pilots around that. And then there are other initiatives referenced in Symp that would be similarly sort of grouped under this subcommittee, such as pilots related to shared decision-making in Maine's proposal to CMMI initiatives like Choosing Wisely. So there's a breakout going on right now, but so perhaps something related to Choosing Wisely, which is a whole initiative to try to engage patients and providers in making smart decisions about the use of expensive healthcare resources, and potentially other shared decision-making initiatives as well. And then there's also an RFP or a proposal within the original proposal to support leadership development for healthcare providers and provider teams. So presumably all those initiatives will group under the System Delivery Reform Subcommittee with, again, guidance and input from that group. Randy knows I get a little nervous when there's language like ensures the coordination and comprehensive of delivery system reforms. The subcommittee is a hard time ensuring, but they'll at least provide input and guidance and help shape those in a way that they are coordinated and connected with ongoing efforts in the state and, again, the other pieces of data, payment reform, et cetera. So I think that's my overview. Move on. Are you taking questions as we go, or trying to go through?
We can. If there are questions, certainly. If there are questions, please don't hesitate to stop us and ask. If none, we will go on to Katie Sensei, who will speak on data infrastructure.
Hello. Similar to a lot of what Lisa mentioned was how her objectives and the subcommittee that Quality Counts is chairing up overlaps and interacts to support other initiatives. Data infrastructure is very much that. The four main objectives that Health InfoNet will be testing, so to speak, it builds on work that's already been happening around the state to really integrate clinical data. But it is also testing new ways of doing that. And so really how do we, in applying for this, it was really how do we leverage the current clinical data that we have and continue to build on the momentum around the state that's really picked up over the last 3 years for provider organizations to really submit clinical data more and more. And then also in the last year with the SAMHSA grant, for those that were familiar with that, how do we build upon those federal funds as well and further the integration of behavioral health clinical data and bridging that gap. So the first objective is unique in that it is testing, providing clinical information and what we call notification, which is really a real-time email delivery to a payer. In this case, it's supporting the state and MaineCare's initiative that's already been underway in the state with all 38 hospitals. They're what's known as the ED project, which many people are familiar with, and looking at utilization and high-cost utilization and impact, and how can MaineCare care managers and provider care managers work together to kind of come at the social issue side, the provider side, at really, and working with the medical homes, keep patients out of the emergency room when it's unnecessary, and push them towards more the preventative side of the system, primary care, medical homes, etc. So all of those initiatives sort of have begun to overlap. And what Health InfoNet will do to support that is to provide some real-time notifications based on the information that comes to the Health Information Exchange. And so we've been working with all the provider organizations across the state to get that project off the ground. And it's very exciting for the MaineCare care managers. A lot of passion from them around turning what is now a very, very manual process into something that's automated, and hopefully for the provider organizations as well. The second bullet is really talking about behavioral health clinical integration of data, and specifically providing an RFP for incentive dollars. I think lots of people are familiar with meaningful use, and that meaningful use provided incentive dollars to certain types of licenses to basically help pay and promote for the transition to go from paper to electronic health record systems. The behavioral health community has not had a lot of access to that same kind of incentive. And so seeing that gap, and Health InfoNet having the primary business goal of getting data integrated, it's got to be electronic before it can be integrated. So really supporting that transition for the behavioral health community where there isn't a lot of funding available. So the RFP will be coming out in the next couple of months under the guise of the data infrastructure subcommittee. A lot of the partner projects sort of have an oversight vetting process through the subcommittee structure because of the nature of the federal funding has to be that way. So we'll be working to release that soon. The goal is to engage 20 behavioral health organizations across the state and try to impact as much of the state as we can to make progress in either upgrading, optimizing their electronic medical records, getting them to talk to the exchange so that that information is available along with the medical information in the system today. Third, supporting the various population health initiatives, accountable communities, all of the stage A, stage B initiatives that Maine Care is doing. Hopefully, Health InfoNet can have a positive impact on those initiatives by using the electronic health information exchange to support giving Maine Care sort of a vision and overview of what's basically happening with their members. Where are their members receiving care? What kind of care are they receiving? For what kinds of problems? To help, so it's a test, right? Is that useful? How is that useful? What could Maine Care do with that kind of information and leverage to help inform their decisions and programs? So we're looking forward to partnering with Maine Care on how that makes a difference. And lastly, a bit of a unique project for us. Right now, for the Health Information Exchange, patients cannot, for example, log into our portal to view their medical record information across the state. But we do make that available through the provider organization. So if a patient goes to their local primary care provider and that primary care provider has access and participates in our exchange, they could print off information via them about their information in the record. But what we want to do is make it easier. And so what we want to do is test connecting the exchange to a provider organization's patient portal, so that the patient themselves can click a button, which is often termed a blue button technology, but it's basically clicking a button that then gives you a print-off sort of summary care document, so to speak, of all of your information that's available from the exchange itself. So it goes beyond your local provider into everything else where you might be receiving care. So that's only 12 months and doesn't run the full 3 years. And so we'll test that with one provider site, and that process will also go through the Data Infrastructure Committee. And I'll just end, because we're short on time, by just saying that for data infrastructure and the subcommittee is really the focus is on how do we get clinical data to talk across the state. Often it's around claims data and how are we using claims data. It's what's traditionally been available to use. And so our focus really here is going to be looking at the clinical data side and how clinical data is interoperable. And what are those standards and how do we educate people about those standards and from all areas of the system and see if we can move it forward from where it is now. So, thank you.
Excuse me?
Yes, absolutely.
Oh, sorry, thank you. I may be behind the curve on this, but I wonder if part of what you'll be trying to advance with respect to behavioral health is how behavioral health data is treated and accessed, and the legal implications and that whole barrier.
How did you guess? Yes, there's a lot of legal issues in this. I always forget the LD number. 1881, I forget. Anyways, but recently in the legislature, over the past year, it was mandated that, well, not mandated, but in a good way, that enabled patients receiving behavioral health care, HIV care, that they are now able legally to opt into the exchange, meaning to share their information. That's a huge win for those of us that believe that sharing and integrating clinical data is going to help us decrease costs, decrease overutilization, all of those things, help people with severe and persistent mental illness, treat their chronic disease, all of those things. So, but we do have still a lot of barriers related to substance abuse treatment in particular. In the record, substance abuse treatment and behavioral health is very much integrated. How do you separate that out? So how do we work with behavioral health organizations to think about, and hospital organizations for that matter, think about separating out their substance abuse data from their behavioral health data so that part of it could be shared while the other could still be restricted because you can't share substance abuse treatment data. So there's lots of nuances around legal issues, and they're not over. It will continue. So we will continue to work on that with our partners.
Thank you. Obviously, as you can see, there's a lot of breadth under the SIM umbrella. We wanted to take that time to try to provide that overview of, you give me a note, an overview of what is contained within Symp, but we also want to ensure that we talk specifically about the commercial sector and the balance of the time. I'm going to turn it over to Michelle to do a quick overview. Is that what this note is about?
Did you mean main care or commercial?
Oh, what did I say?
You said commercial.
Okay, we did a quick overview of main cares, maybe a few minutes, Michelle, just to, around what's involved there, and then we'll go to the commercial sector.
Which I'm not covering.
Which you will not see it.
All right. I'm not here to speak to the commercial side since I represent main care. I was panicking there for a second. So just, we thought it might be a good idea just for me to mention a little bit about the department's value-based purchasing strategy, since a number of our partners mentioned initiatives under that strategy. So the Maine Department of Health and Human Services value-based purchasing strategy existed prior to the Symp grant, and is our effort to move away from paying for volume under fee-for-service. We recognize that Maine Care, along with other payers, needs to change the way that it does business, especially in financially trying times. If we don't move towards supporting the kind of care that we know will result in both lower costs as well as improved health outcomes, we're going to continue to be forced to make difficult decisions around eligibility cuts and rate cuts, et cetera. So under our value-based purchasing strategy, first, as a foundation in terms of transforming delivery of care, we were very lucky to partner with Lisa and Maine Quality Counts on the development of our Maine Care Help Homes initiative, which very intentionally built off the foundation of the multi-payer patient-centered medical home pilot in the state. And so they align, not 100%, but very closely with one another, and we're happy to report that since last January, over a third of Maine Care's primary care practice sites in the state are participating in our Health Homes initiative, and we're thrilled that under Symp, those practices that are outside of the multi-payer pilot now get the same level of support in terms of transforming care at the delivery site. The second stage of our Health Homes initiative is our behavioral health homes, and any day now a request for applications will also be issued for that initiative. It's specifically targeted to serve our adults with serious mental illness and kids with serious emotional disturbance, and as Lisa mentioned, it's a partnership between primary care practices as well as behavioral health organizations, which are oftentimes the home of care coordination for members with SMI or SED. And then lastly, we have our Accountable Communities Initiative, which is Maine Care's version of a shared savings accountable care organization, or ACO. And I'm afraid that by saying it, it won't be true, but today, our request for applications should be posted. I keep checking my BlackBerry to see whether or not it's up there yet, but it will be. So if you go home, or go back to your offices rather, and Google Maine Care Accountable Communities or Maine Care Value-Based Purchasing, you should be able to get to our request for applications if you don't receive a direct email about it. So under the Accountable Communities initiatives, providers are able to come together, providers broadly defined, so we're not just talking about primary care and specialists and hospitals, we're also talking about behavioral health, long-term services and supports, and any other providers under Maine Care, really. Providers come together, and if they're able to achieve savings on an assigned population of Maine Care members who are receiving most of their primary care through those providers, if they're able to achieve savings, then they can share in those savings commensurate with their performance on specified quality measures. So that, was that quick enough, Randy? Okay, thank you for the opportunity.
Thank you, Chef. So now we'll just fast forward through a few slides here and get to specific discussion around what Symp means for the commercial sector.
And just very quickly, because we're running out of time, just as a wrap up, I just want you to all sit there and I know we all appreciate that the state of our healthcare system impacts each and every one of us, both at a personal level and at sort of an economic level. We sit there and think, how long has it been since you've had a raise? Or since you've been able to give your employees raises? I know in my case and in business I recently ran, it's been a long time. And it's because we're spending our money on, a lot of our money on healthcare, and the rate of increase is just not sustainable anymore. And as Michelle says, we're in the same boat in the commercial sector. We have to make hard choices. And as if you were in the sessions this morning, businesses making hard decisions every day about what they're going to or not going to spend their money on. And sometimes those decisions are made rationally and sometimes not so rationally. SIM is about, or the effort to transform our healthcare system is about finding some rational approach to this problem. We all need great care. It doesn't matter who we are or who pays for our care. We all need great care. And high quality evidence-based care is going to result in less need for more complex, more costly care. And at the end of the day, that's lower premiums, lower cost to payers and purchasers, lower out-of-pocket expenses potentially, and lower taxes, or our ability to reallocate our scarce tax dollars in ways, in other ways that we are important to invest in. We also need to make sure that we're helping make the system more rational for our provider community. Primary care is a relatively scarce resource, and we need to provide support to them, particularly in our own state. We need to help them make care more efficient and more fulfilling. It's all part of this very complicated effort that we're calling SIM, which seems scattershot when you hear us talk about it. But the more you listen, and I think the more familiar you get with the initiative, you figure that you can see what we're trying to do is take all these disparate streams of activity and align it all. So if we're all rowing in the same direction, instead of bouncing off one another, we're more likely to get to our goal of a rational, effective system where we're able to deliver effective quality care, improve patients' experience of care, and lower costs. And just as an example, the partners have been working with the department in terms of developing quality metrics that will be tied to payment for their accountable communities initiative, trying to make sure that it won't result in increasing burdens on providers, but that it helps further the interest of realizing higher quality care for main care's patient population. That's what SIM is all about. The moral of the story here is that, again, to bear in mind this is a collaborative effort. One of the things we're testing here is the power of collaboration as opposed to top-down regulation. There are SIM states, I think Oregon is a very top-down model. Testing, it's a legislative model or a regulatory model. Ours is a bottom-up model. But in order to work, we need everybody at the table. So employers, purchasers, payers, providers, consumers are all invited to this table. If anybody wants to be on an interested parties list, I bet there are people in this audience here who aren't involved already in SIM governance, because we have like 100 people in governance. But there's room for even more. So if you ask any one of us, we'll put you on an interested parties list. We'll invite you to more work groups. than you can shake a stick at, but we really do hope that you come and participate. So with that, we'll close. Sorry, we ran way over our time, but our panel time, but if anybody has any questions, please feel free, and we'll all be around for the rest of the day, I believe.
And I just am going to say that our RFA is now posted for accountable communities. So if anyone starts rushing out of the room, I know because you want to go look at it right now, and we understand.
Judy,
I'm just curious, in light of the conversation that we heard this morning, sort of helps you start to think about it. Is there anything outside the Department of Health and Human Services where we might be able to apply some of these dollars to begin what I would say is a change in culture in the U.S. around education of our young people and others that might help us begin to develop a groundswell of how we as Americans change the way we look at healthcare and the way in which we look at healthcare for ourselves?
the CDC, as part of this, has a project around public engagement and communication and education. So I think their role in terms of addressing the public and population health, to your point, is a funded project under SIM in particular. We don't have Debbie from the CDC here today to talk more specifically about that, but it will be coming to light through the different committee work around that. And obviously, I think Debbie would say it's fair to say without the engagement of many, many kinds of stakeholders, that kind of education campaign would not be effective and implemented. So I myself am looking forward to that in particular. Because a lot of these topics, unless you live in this world, you don't necessarily understand all of this, especially health information exchange, as I've come to learn. I don't know if others have.
I just add a little bit on that. There's a significant focus from CMS on marrying, if you will, objectives with federal level initiatives with state level initiatives to create greater synergy. So that's a part of the SIM focus from that perspective as well at objectives.
And if I could do a follow-up, a lot of the healthcare plans that we see now are all sort of starting to focus on wellness and on all those things, and some of our small populations don't have the benefit of that, including our main care as much. And so I would assume that must be part of what we're doing in population health and all the other pieces that we're involved in, but I'd love to see, I'm sure there are plans for more of that as well.
Although I don't know if you heard Dr. Fendrick's comments on all this morning. No, I'm sure she'll be talking more about that.
Is dental health involved in this initiative?
Not specifically. I think, is dental included in clinical communities, or is it an optional service?
We do, under our Accountable Communities Initiative, the cost of dental care is optional to include. The reason why we make it optional is because we recognize that from MaineCare's perspective, it's hard for us to mandate that providers be held accountable for the cost of dental when we're not paying for adult dental services unless it's on an emergency basis. Having said that, we do think that there's great opportunity for partnerships between dental practices and other providers to form accountable communities, and they do have the option of including the cost of the dental services. But we know that the dental care is obviously very interrelated with other health outcomes on the medical side, and so those partnerships could be beneficial to patients, to MaineCare from a dollar perspective, and also to those providers themselves through the shared savings arrangement.
We're just given the sign from the back of the room that it's time to give him the hook. But thank you all for your attention. I'll leave you with this theme that we hand out to our steering committee every week. We talk about the importance of collaboration and that this is a grassroots transformational effort that Maine is taking. And just to add to Ellen's plea of involvement and engagement, it's really important for those of you who are familiar with the Institute for Civic Leadership. This is their key theme, and we've carried that forward into the SIM program as well, so we can all work together to transform healthcare. Thank you very much. There is also a brief on what the state innovation models are on a national level. I think it's in the back of the room for you to pick up and for more information to take with you. Thank you.